Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love.
Welcome to Sweet Talk, the healthy drinking series with Lake Health and Wellbeing. I am your host, Iceline Phillips. This series is brought to you as part of the Your Sweet Enough Health Education campaign, which is geared towards educating and mobilizing the public to make healthy drink choices. In this episode, we'll be learning about the collective health impact of sugary drink consumption across the Caribbean region, and we'll be discussing the regional response to combating non-communicable diseases and related health problems, which we are really seeing at an increasing rate as a result of the overconsumption of sugary drinks and poor diets within our island. I am really excited to have in conversation with me today Sir Trevor Hassell, who is the president of the Healthy Caribbean Coalition, also known as the HCC. I'll invite Sir Trevor to introduce himself and tell us a bit about the HCC and what the organization is doing within the region. Over to you.
Good. So thanks very much. So as we said, I am Trevor Hassell, and I'm president of the Healthy Caribbean Coalition, which is a regional civil society NCD alliance in the Caribbean. First of all, I'd like to thank Lake Health and Wellbeing for providing us with this opportunity to have really a conversation about chronic disease prevention and control in the Caribbean in this COVID era. Lake Health and Wellbeing has been for many years a member of the Healthy Caribbean Coalition and has played a significant leadership role in NCD prevention and control. And so we're in really very challenging times in the Caribbean and have been for some time with the occurrence of the pandemic, the COVID-19 pandemic, which has occurred in a setting in which we've got an epidemic of chronic diseases. And what the COVID-19 pandemic has shown is the tremendous vulnerability of persons living with NCDs. As a result of this, the Healthy Caribbean Coalition produced a report and a major publication titled A Transformative New NCD Agenda, which really aims to, as it were, craft a new way forward in the approach to NCD prevention and control. And that new way forward takes into consideration the human rights issues, issues of equity, and also people empowerment and a people-centered approach. And so the publication is one that I said will be addressing the NCD issue through this lens and with these priorities.
Great. It's really good to hear. So we really appreciate you taking the time to sit and have this conversation with us because, we know that it is a really important conversation for us to be having based on the shared, as you said, it is an NCD epidemic that we're seeing. So to dive right in, could you tell us a bit about what the actual health trends and statistics are when it comes to health conditions like obesity, diabetes, and NCDs across the region? What are the Caribbean trends that we see?
Yeah, well, this is an area of particular concern and has been for many years. So we've got, for example, 60% of in most Caribbean countries, 60% of our adults are overweight and obese. A third of our children, likewise, are overweight and obese. It's estimated that 15 to 20% of our adults are diabetic. And why is this important? This is important because obesity predisposes to chronic diseases, many of the chronic diseases. And the chronic diseases account for some 8 to 10% of all deaths in most Caribbean countries. The frightening thing is that a third of these deaths occur in persons before the age of 70 years. So it's really very, very concerning. And it's the more concerning because of the fact that the trend is worsening. So we have not been seeing an improvement in the situation. But it's not only a health issue, it's also an issue in which, again, it's estimated that some 60% of most of the health budgets in the Caribbean are spent on NCDs. So in summary, NCDs represent a significant threat really to socio and economic development in the Caribbean.
Right. So what would you say are the links between the health conditions that we're seeing at an increasing rate and its connection to unhealthy diets in terms of food and especially the consumption of sugary drinks in our island?
Yeah, well, these are the so-called risk factors of which a healthy diet is a principal risk factor, particularly high sugar intake, also a high salt intake, and also fats and saturated fats. So these constituents of the diet, these constituents, if consumed in excessive amounts, certainly contribute significantly to the chronic diseases. And specifically the sugar-sweetened beverages certainly are major contributors. Because really what they do is they produce obesity, they contribute to some of the cancers, they contribute to heart disease. And these sugary-sweetened beverages are consumed in the Caribbean to a much higher degree than they ought to. Some data has shown that the region is among the top consumer of sugar-sweetened beverages. To give you a sense of this, it's estimated that throughout the Caribbean, the consumption is 2 to 2.5 servings per day of sugar. And so that you have a comparison, in the United States of America, that's 1 serving per day. So as you see, it's sugar-sweetened beverages contribute significantly to the chronic disease epidemic.
Right. So considering the reality of this overconsumption of sugary drinks, which then connected to the NCD health epidemic that we face, and which is very common across the region, how have our Caribbean leaders responded to this public health threat and these challenges?
Yeah, well, interestingly enough, I would say very well. For the most part, very well. So in 2007, leaders of CARICOM met and issued the Port of Spain Declaration, uniting to stop the epidemic of NCDs. And really that meeting and the declaration was really the beginning of major global initiatives aimed at addressing the epidemic of NCDs. And ever since then, both heads of governments and ministers of health throughout the Caribbean have been addressing NCDs or chronic disease in one form or another. One of the most recent was some 3 years ago, when the heads of government spoke to and addressed specifically the issue of childhood obesity and expressed concern about childhood obesity, and went further and, if not mandated, certainly sought to encourage an approach to childhood obesity reduction that is based on front-to-package labeling, and also healthier school environments. So there have been significant leadership from our political leaders, both at the level of heads of government and also at the level of ministers of health.
That's really good. That's really great to hear. And I think that definitely highlights the seriousness of the issue when we have political leaders coming together to agree on really just resolving it as a collective. So that's really good to know. So we'll just take a short pause right now before we dive into other questions.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
Okay, so now that we know that this is a priority for our Caribbean leaders in terms of combating the NCD epidemic. There was some things that you mentioned in terms of front of pack labeling and having an action plan to address particularly childhood obesity. But tell me a little bit about what the civil society response has been to the NCD epidemic and particularly as it relates to reducing the consumption of some of these sugary drinks and high salt diets. What is being done collectively within civil society in order to combat the root causes of some of these public health problems and the conditions that we're seeing?
Yeah. Well, first of all, a kind of a general statement, and that is that really civil society organizations, health NGOs, for many years throughout the Caribbean have been contributing to the effort. Your own organization, Lake Health and Wellbeing, has, as I've said before, for many years has been playing a part. The Heart and Stroke Foundation of Barbados has been particularly engaged in efforts related to chronic disease prevention with emphasis on cardiovascular disease, which is one of the most common of the chronic diseases. And so too, for example, has the Heart Foundation of Jamaica. And interestingly enough, in Trinidad and Tobago, there's been a recent significant development where many of the civil society organizations have come together to form a Trinidad and Tobago NCD Alliance, again, which is at addressing the concerns of the NCD epidemic. So there has been a tremendous civil society response to the epidemic at national level. Sure.
That's really great. That's really great. So we know that HCC is a regional organization, a regional alliance. So tell us a bit about how the Healthy Caribbean Coalition is leading and coordinating advocacy, particularly for policies and policy interventions that really help to address unhealthy sugary drink consumption in our islands and across the region.
Yeah, well, this is as again an issue that for at least 3 to 4 years now we have been addressing. And first of all, it really was informed by, if you will, our prevention for childhood obesity strategic plan, which we launched in 2018, which outlined several of the priority approaches. More recently then, as I indicated at the very start of this conversation, our approach now has been influenced by the transformative new NCD agenda. And the thing about that is that as a result of inequities, vulnerabilities that have been shown up during COVID-19 for persons living with NCDs, our approach to addressing the problems of childhood obesity through reduction of sugar-sweetened beverages has been positioned, if you will, under an umbrella of approach that speaks to a life course approach, social inclusion, people-centered, partnership approach, and accountability for decision making. Mm-hmm. And I say then to say that our approach to sugar-sweetened beverages is threefold, the policies we're seeking. First of all, front of package labeling of prepackaged goods. Secondly, an improvement of the school health environment throughout the Caribbean. Mm-hmm. And thirdly, and equally importantly, a tax on sugar-sweetened beverages. So those are the three fundamental policy asks that we are seeking to have implemented across the region.
Great. Could you just tell us a little bit about, so you mentioned these policy asks, could you just tell us a little bit about what they would entail? So front of pack labeling, what is that about? What are we talking about when you say about improvement of this school health environment, and particularly, you know, the type of policy that's for like taxes on sugar-sweetened beverages? What are each of those things intended to achieve?
Sure, fine. So let us start with the tax on sugar-sweetened beverages. Some Caribbean countries have already imposed the tax. For example, Barbados, mm-hmm. Dominica, and Bermuda. Mm-hmm. And the thinking behind the imposition of such a tax is really to make the healthier choice, not the cheaper and more affordable choice.
Right. Mm-hmm.
Really the underlying thinking behind the tax in Barbados. Mm-hmm. Early data shows, in fact, that there has been, as a result of the tax, despite the fact that it's not at the optimal amount, which is 20%, that there's been a reduction of 4% consumption of sugar beverages, and correspondingly, I think it was estimated at something like an 8% increase in sale of water. Mm-hmm. As far as the school environment is concerned, here we're trying to create a situation in which, quite frankly, sugary beverages are just simply not available in schools throughout the region. And finally, the front of package labeling can be summed up really in a very simple way. That is, there is a need for consumers to be aware of what they're eating. That's the simplest way to address it. Right. And so the mechanism that's being used is that on the front of package of prepackaged goods, that there are warning signs, warning label. What has already been decided that these labels should be black octagonal warning labels, indicates that the product is high in sugar, high in salt, high in fat, so that the consumer very easily, just simply, easily and quickly look at a product and recognize that it's high in a salt or sugar or what have you, and then make informed decision. And that's the important point there.
Right. And I think you did mention previously in one of the questions in terms of the response of Caribbean leaders is that this front of pack labeling is actually something that CARICOM leaders are voting on in order to standardize across our islands, just as a regional approach, correct?
Yes, absolutely. This is a process that is ongoing. I think it's a 5-step process that determines a standard of labeling throughout the Caribbean. And if my memory serves me correctly, I think 2 steps in the process have been determined and finalized. And at the moment, the lead is for the, as I said before, the black warning labels, high labels. Certainly the Healthy Caribbean Coalition is highly supportive of this form of labeling, recommended by the World Health Organization and PAHO, and specifically PAHO. And there has been significant research undertaken in Jamaica to that this is the most effective form of labeling to achieve the outcome that we're aiming for.
Right. And that's really good. And just to reiterate for everyone, what we're really trying to achieve here is to really lower the rates that we're seeing of like non-communicable diseases, and particularly as we're seeing it in younger and younger people, which is why childhood obesity has been such a focus for these NCD alliances that we see with the Healthy Caribbean Coalition and of course nationally. So it's been really, really informative to have this conversation with you, Sir Trevor. And we are at Lake Health and Wellbeing always supportive of the Healthy Caribbean Coalition and the work that you do. And we appreciate you as a partner. And we wish you the best of luck in terms of the new transformative agenda, which we fully support in whatever ways that we can in the capacity that we can here in St. Kitts and Nevis. So thank you so much for your time. I don't know if you have any last words for us, but I invite you to offer those as well, and what we were talking about.
Yes. So again, thanks very much for the opportunity. I think my parting words would be to recognize that in the midst of this pandemic, persons living with NCDs are particularly vulnerable. And the pandemic has shown that as I said before, inequities and really human rights issues related to those with NCDs, and we all now need to build on the time-tested and proven approaches to reducing NCDs. But we also now need to address NCDs using these additional approaches, such as a rights-based approach to the issue.
Great. Thank you so much. And there you have it. This was our episode of Sweet Talk, the healthy drinking series with Lake Health and Wellbeing. We were talking about the dangers of sugary drinks within the Caribbean region. And we want to thank our special guest today, Sir Trevor Hassell, who is the president of the Healthy Caribbean Coalition. Thank you all so much.
Thank you.